The scientists from the University of Maryland School of Medicine have done a trail of organ-transporting drones in the United States. Dr. Joseph Scala and his group made various experimental tests conveying a human kidney in March. He said his organization once paid $80,000 to transport one liver on a sanctioned flight. He trusts that automaton could cut expenses while reforming the utilization of transplant organs. Boundaries to more extensive selection of regular citizen Ramble flights fall into three general classifications, he stated: human effect, innovative and administrative. But, worried about the impact on the doctor-patient relationship as organs are transported by drones. The second covered stresses over speed, range and safety in the circle that is inconsistent advancement. The third concerns the tenets and directions covering Ramble flights, about which specialists have been vigilant. With drone innovation progressing rapidly and indications of development in the administrative condition, Scala stated, his primary concern is persuading organ givers, beneficiaries and their families that Ramble transport is what's to come. Medicinal conveyances by drones are progressively higher. The United Nations Youngsters Association, UNICEF, sorted out the transportation of an antibody crosswise over precipitous landscape in the Pacific island country of Vanuatu. The services done by an Australian organization called Swoop Aero. Be that as it may, different sources are progressively wary in their expectations on the prompt effect of automatons.